Professor Philip Chu, Group CEO, National Healthcare Group, Dr. Eugene So, CEO, Tan Tock Seng Hospital, Ms. Anita Pham, Chairman, Institutional Committee, Tan Tock Seng Hospital, Mr. Ching Wei Hong, Chairman, Families for Life Council, distinguished guests, speakers and judges, members of Care Connect Volunteer Committee, patients, caregivers, community partners, volunteers, and healthcare colleagues. A very good morning. It gives me great pleasure to welcome all of you to the annual Singapore Patient Conference. It's wonderful to see many patients, families, and volunteers among us, and we thank you for your continued support towards this meaningful platform where we learn and co-create care together. We are also very honored to have with us the presence of Senior Minister of State, Ministry of Health and Ministry of Environment and Water Resources, Dr. Amy Khor, and our special guest to join us for this fourth installment of the Patient Conference. On behalf of the organizing committee, I would like to thank all our Singapore Patient Action Award judges, guests and friends for making time in your busy schedules to join us today as we honor our caregivers, patient advocates, and volunteers, the unsung heroes in our healthcare system. For the Singapore Patient Award ceremony today, we are very privileged to have a distinguished panel of judges from the healthcare and community services sectors, including Ms. Teo Sin Woon, Deputy Secretary, Development, Ministry of Health, Dr. Wong Lun Man, Principal Consultant and Chief of Care Transition Division, Agency for Integrated Care, AIC, Ms. Anita Pham, Board Member, National Healthcare Group, and Chairman of Institutional Committee, Tan Tock Seng Hospital, and Associate Professor Chin Jin Ji, Divisional Chairman of Integrative and Community Care, and Senior Consultant in Geriatric Medicine, Tan Tock Seng Hospital. A special note of appreciation goes out to the wonderful and talented volunteers of Peace Connect Senior Activities Center from the Kampong Gram community for starting the conference on an uplifting note with your vibrant and energetic dance performance. I'm still recovering my breath, after dance. It was a joyous sight to behold with everyone getting involved into the dance of acting and dancing together. Thank you so much for showing us that age is just a mental state of mind, and everyone has the potential to make a positive impact on the community. Volunteering has always been an integral thread in the fabric of our society, and our volunteers and patient support groups are very much a part of the Tan Tock Seng Hospital informal workforce. They are not paid, by the way. So very often people ask me, what do you get as volunteer? Nothing, maybe some free drinks. Yeah. The topic on volunteerism has been a highlight of the Singapore Patient Conference since we started our journey in 2013. Over the years, we have heard many touching and powerful stories of healing from our volunteers. All of them were inspired to come forward to share because of a common mission, and that is to make healthcare better and to make a positive difference to the community they serve. Being a volunteer myself, I have a deep connection with Tan Tock Seng Hospital since starting my first volunteering stint here as a night sitter 9 years ago when I retired in the year 2007. As a night sitter, I would go to the wards and help the nurses to watch over the sick and the frail elderly from 9 p.m. to 7 a.m. the next morning. As studies have shown that the fall risks among patients are higher, tend to be higher before the patients go to sleep and when they wake up. It was a very tiring and yet extremely fulfilling experience, knowing that I can make a very small difference in the patient's healing process. And hoping to do more to help more patients and their families, I also started volunteering at Ren Tzu Hospital, Amokyo Taiwan Hospital, and other healthcare organizations. Besides night sitting, I have been exposed to various other volunteering opportunities at Tan Tock Seng Hospital. Being part of the Care Connect Volunteer Committee since 2013, The volunteer members and I have been co-creating patient-centered improvement projects together with the healthcare teams, and we have seen improvement in patient satisfaction. I'm very grateful to Tan Tock Seng Hospital for giving me this wonderful opportunity to personally befriend, connect with, and help reach out to our patients, families, and caregivers. Being part of the informal workforce and the extended network of 27 volunteer groups and patient support groups, we have the greatest privilege of learning from passionate individuals who have inspired us with their courage, empathy, and generosity of spirit, often in the face of adversity. I'm very pleased to share that we are today paying tribute to 11 unsung heroes at the second year of our Singapore Patient Action Awards ceremony. And we have invited our patient advocates and volunteer groups to share their inspiring stories today with us later. These award recipients have often gone through the extra mile to extend their help to neighbors or even strangers at unexpected time. Such are the wonderful acts of kindness which truly make a difference to the lives of the others in need.
Through a theme for this year's patient conference, Activating Patients and Families, we hope to engender a deeper appreciation of what it takes for patients and their families to be truly engaged, empowered, and activated in building a relationship with the healthcare team to make shared care decisions, playing an active role to lead a healthy life, and be empowered to manage chronic diseases in their homes and the community. As a geriatrician, I've seen our elderly patients' healing journey transform by greater involvement and engagement from their family members. Beyond the family nucleus, their willingness to share their personal stories with the medical community will allow clinicians to empathize better and to build deeper relationships with our patients and caregivers. To start the movement on patient and family activation, we are now moving beyond healthcare borders to build new collaborative partnerships with partners such as a Family for Life Council to support our focus and sustain our efforts in delivering patient-centric care. Today's Memorandum of Understanding between Tan Tock Seng Hospital's Families for Care and the Families for Life Council provides a stepping stone to build social support between families and activate patients in taking charge of their healthcare needs and decisions. Families for Care will be bringing health-related resources and providing the required domain expertise to run programs as part of the Families for Life's new Family 365 programs. Do visit the websites of both Tan Tock Seng Hospital and Families for Life to find out more. With this meaningful partnership, Families for Care and Families for Life aim to foster a positive and nurturing environment for patients and caregivers to share new ideas and deepen conversations pertaining to healthcare concern. TTSH Care Connect Volunteer Committee will act as a sounding board, and activities will be held within Care Connect, the dedicated patient experience center in TTSH. In line with this year's theme, Singapore Patient Conference has grown significantly in size and scale by extending its outreach beyond hospitals' four walls, all of which are organized by the institutions under the umbrella of National Healthcare Group and the Agency for Integrated Care, with the generous support of the Ng Teng Fong Healthcare Innovation Program. We are also thankful to all healthcare and community partners who readily jumped onto the SPC community bandwagon to support our outreach to Central Singapore. Through interactive activities such as educational talks, health checks, and self-care resources, we bring healthcare to the doorsteps of more than 700 residents residing in Toa Payoh, Teck Ghee, and Whampoa. For today, we have similarly organized an exciting lineup of inspirational speakers from all walks of life and fringe event activities, exemplifying what it really means for patients and families to play an active role in healthcare and to give back to the community. Through the meaningful interactions and stories shared today, we hope that many of you will also be inspired to pay it forward and do your part for healthcare. Together, we can accomplish so much more than any of us can do on our own. We wish you a most enjoyable conference ahead. Before we invite our guest of honor, Dr. Amy Kaur, up on stage to give her opening address, we would like to play a video showcasing the highlights of our community outreach in Central Singapore over the past 3 weeks. A big thank you to our patients and families who have joined us on the meaningful journey of co-creating a better healthcare environment. Thank you. Can we roll the video? Thanks.